I'm here to talk about how collective intelligence might be mobilized to augment our ability to create better health. And health can often be quite personal. I think we all have our own understanding of what it means to be in better health at the individual level. But what we're excited about at Nesta, the organization that I work for, is how we might learn to mobilize new emerging resources of intelligence that we have available to us across society to develop collective understanding of what better health means. And hopefully by the end of my talk, you'll also think it's a really important application area for some of the new technologies and how we can connect people together to work towards a common purpose. So I work for the organization Nesta, as I mentioned. We're an innovation foundation, which means we're an independent charity based in the UK, but a lot of our work is actually global. And we are concerned with solving social challenges. So developing new types of innovation methods for the public good. And these are the 5 core priority areas that we focus on. As you can see, we work on health as one of those. And we carry out research. We try and codify and develop new innovation methods so that civil servants can start to apply them in their work. We also train up civil servants to have more of an understanding of what innovation skills are, and we fund others to do similar work because we realize we can't do everything ourselves. About 18 months ago, we launched a new program of work called the Center for Collective Intelligence Design. And this new program of work is very much inspired by the work of MIT and other leading research centers, but with the focus that Nesta has in mind of translating some of those insights from academia into practical applications. So how can we actually start to put these ideas into practice? That's what we're working on. We're trying to codify some of the methodologies. So when we talk about carrying out research from our center, it's all about how can we develop practical solutions at, say, a city scale to address city problems drawing on different resources of intelligence. Or we carry out demonstration projects which are about practical applications in the field, working with government partners. For example, we have a new program of work called Open Jobs, which is looking at mobilizing novel data sets as well as an understanding of how people look for jobs to transform our approach to labor markets at a city and regional level. We're also working with the UN Development Programme with their new scheme that they've launched this year of 60 innovation labs, where they're looking to apply collective intelligence as a core new methodology in order to change the way that development is carried out globally. And we're developing a learning curriculum and a toolkit for them so that we can, again, translate some of those insights coming from the research into practice. So I guess our core definition, very much inspired by some of what Celia was saying earlier, is this idea of mobilizing human and machine intelligence, so combining diverse perspectives, data, and new technological capability in order to work together towards a common purpose. And we see that AI is a core contributor or part of that, but it's not the only part of the story. And a lot of our problems are very human problems. So we really want to maintain the focus of AI being one of the tools of intelligence that we have in our toolbox, but really it's up to us to work together in better ways. And we think technology is enabling that in 3 core ways. One of that is just connecting more of us together through some of those digital platforms so that we can create shared resources of knowledge like Wikipedia, but also to mobilize and connect people who have common issues of interest. We see that in health through peer-to-peer patient networks, for example. The second type of technological innovation that's helping to mobilize collective intelligence at scale is about distributed sensor networks that are helping us to have better ways of tracking both the external world and our bodies, and so that we have a more nuanced understanding of multidimensional data that is impacting health. And thirdly, it comes to the artificial intelligence, of course. So some of the functions of intelligence that we have previously associated with human capabilities, when we scale that up, in the age of big data, we find it quite challenging to process and spot patterns in those kinds of data sets. And that's where we think it's really important to draw on technologies like artificial intelligence to help us spot patterns and also to make better models and predictions of how the world is changing around us. When we think of collective intelligence, we always think it's important to keep a purpose in mind of why are we mobilizing these resources of people, data, and technology. And we like to think of it in terms of the innovation cycle and the kind of methods that collective intelligence draws on. So from crowdsourcing to citizen science to open innovation to challenge prizes to digital democracy platforms, they can be applied at different stages of the innovation cycle to get better results, or they can be applied at multiple stages. Over the next couple of slides, I'll be talking about how it's possible to apply those methods in order to realize real opportunities towards better health by highlighting some of the examples that we have been finding out through our research and mapping of case studies. So when it comes to understanding problems, what collective intelligence can help you do is to develop a better understanding of an issue where you have incomplete information, or maybe the dynamics of the situation are changing so rapidly that your previous or historical data is no longer representative of how the situation is evolving. And so key characteristics of this type of collective intelligence method is about developing new data sources and integrating contextualized insights in order to generate new models and predict how the world is changing. When it comes to health, a canonical problem that this can be applied to is how to predict outbreaks of disease or medical emergencies. One of the examples we really like in this space is called artificial intelligence in medical epidemiology system. It's something that can help to predict dengue fever outbreaks up to 3 months in advance of them occurring. And it works by integrating lots of different data sources, some of them that influence the spread of dengue fever, and some of them by crowdsourcing actual notifications from clinicians on the ground who spot cases. And so through this integration, there's a more accurate model that's been developed, which has a precision of over 80% that can give a probability at a finer temporal and spatial scale. When it comes to the second type of collective intelligence, helping us to find and generate better solutions, when you would apply this is typically when you understand the problem well, but you need to mobilize greater amounts of people and new types of technologies to help you address it. Archetypal methodology that we really like at Nesta is called a challenge prize. It's typically applied when you need to incentivize a broken market and really mobilize at scale lots of new ideas for solutions. The Longitude Prize, being run by my colleagues since 2014, is helping to address the problem of antibiotic resistance. It's been predicted that by 2050, if nothing changes, we might have up to 10 million deaths a year from antibiotic resistance. And we know that some of the problems associated with this are overprescription of antibiotics and also the development of superbugs. And so the challenge is to develop a very specific point-of-care test that identifies bacterial infections that can be easily distributed globally. And it now has 68 teams spread across 12 countries, all trying to find a solution to that problem. Some of these are using AI, and some of them are using other approaches. What's really exciting about this methodology of collective intelligence is that it not only uses incentives such as financial rewards and competition to generate the final solution, but it creates a whole ecosystem, a whole new ecosystem of innovation to address a particular problem. The fourth type of collective intelligence is when you might need to draw on different perspectives in order to make a decision that is more legitimate. Say, for example, you're prioritizing health policy and you need to get buy-in from the people who are affected by the problem. Or you need to access different sources of expertise because you don't have the knowledge in-house to make the decision based on evidence. A really simple but very effective solution is the epistemonikos system, which was developed by an organization in Chile. It addresses a challenge in healthcare of clinical evidence being very distributed across different databases. And what the machine learning system does is it scours these databases to identify all of the systematic reviews that pertain to a particular clinical issue. After it assembles this primary resource, it's then further curated by experts, by doctors and medical students, in order to provide the best possible evidence to inform health policy decision-making. It's been taken up by the Chilean government in order to issue new health guidelines at an accelerated pace. Picking up on something that Paul was saying about understanding the decision-making process and where your new technology can be best placed to serve the need that it wants to serve is something that epistemonikos had in their mind from the very outset. They understood how decision-making in terms of health policy is made and the gold standards that are approved by the industry in order to identify that systematic reviews would be the best source of evidence in that context. The final type of collective intelligence I want to talk about is when you're trying to maybe monitor implementation or accelerate learning at scale. And it comes at the end, typically, of an innovation cycle. But one of the things that we notice in terms of characteristics is that there are often shared resources, shared repositories of knowledge and tools that are ongoing and continually developed by a community, which allow this learning to happen at unprecedented scale. The Human Diagnosis Project is one such example that solves the health problem of, have you ever heard, get a second opinion for that? How about a third opinion, a fourth opinion? It's trying to assemble the biggest global resource of case knowledge and differential diagnoses, which is crowdsourced from doctors globally, in order to create not only a resource that can be accessed by the medical community, but something that can be accessed by innovators and patients as well. In a way to address very specifically the learning gap and the difficulty of developing diagnostic reasoning, the platform has also got an accompanying app which sits on top of it and distributes quizzes, medical quizzes, to students who can use it to help develop their diagnostic capability. And so I've given some examples of the reasons why you might choose to apply collective intelligence. But one of the things we're really keen at about at Nesta is thinking about the whole system of healthcare and trying to develop intelligence assemblies that might work all the way through the healthcare pipeline, from research and discovery that draws on crowdsourcing and citizen science, to long-term management by establishing complementary networks of healthcare providers and patients. And we think there are 5 core building blocks. This is a working model, so please do tear it apart and question it. But we think these are core characteristics that will allow us to take advantage of some of those new resources of intelligence, including the artificial intelligence technologies that other speakers are mentioning. So we think it's time for a new type of information commons. And this means integrating the typical types of data sets that we've been using to make decisions about health, but also integrating lived experience and the kind of testimony provided by carers in order to provide more nuanced insights about the things that matter in healthcare. We think it's important to have these information commons in the open so that they can be used by many different people and that they can be searchable, such as tools like epistemonikos, helping us to organize that knowledge in ways that it can be more effectively used. We also think it's important to open up new communication channels between patients and healthcare providers so that we're involving patients all the way through and helping them to contribute to the problem solving in healthcare. There's also, we think, the need to examine other contributory factors to health behaviors. One of my colleagues in Nesta in the health lab is running a project called Good Help, which is trying to identify through ethnographic research what some of the socio and cultural circumstances are that contribute to people's health behaviors and what it is that might motivate them to make the change. This is a complete reframing of how we issue health guidance in terms of public health. We also think, apart from a more people-centered approach, it's important to think of health in the context of the place where people are living and how it occurs. And this is drawing on new support systems within neighborhoods, such as a project that we've observed in Brazil called Safe Neighborhoods, which has used smart technology planted across a neighborhood to try and improve or allow for elderly independence for longer in that community. But it could also mean the opportunity to think about health at a city scale and what are the things that you should be tracking in order to understand the changes and outcomes in the city when it comes to health. One of the most important building blocks is the final one. It's the most challenging, but perhaps the thing that is most vital for us to realize the opportunity of artificial intelligence, which is often very data hungry. It's about establishing new types of data partnerships across different actors in the public and private sector, as well as citizens. We really like the model of data collaboratives, which rely on forefronting governance principles and having intermediaries act as data stewards to ensure that all parties are adhering to agreed principles and that data is being shared to benefit everyone involved. We're testing out some of these ideas with our own work. A project that we started earlier this year is a partnership with the National Health Service's National Cancer Registry, which is a vast data set that tracks patients diagnosed with cancer across the UK throughout diagnosis and treatment and management of their condition. We started off with a pilot research project which took that data set and integrated it with lived experience and testimonies of carers and healthcare providers to produce this beautiful visualization that helped us to realize actually the healthcare pathway that is being described by routes to diagnosis data isn't as simple as it appears to be, and there are many loops that need to be accounted for. It helped us to identify potential leverage points in the system that can help us to move towards better prognosis and earlier diagnosis of bowel cancer. Apart from our own work, we're really excited about many existing initiatives that are taking forward some of those principles that I highlighted in the building blocks. I want to talk about them briefly. So this is a kind of system that we might imagine which is integrated. I'm not sure why this slide is still here. I meant to take it out. But moving on to the examples that we see. One of the really core items that I've been mentioning throughout is about integration of different types of data. Of course, that's not easy, especially when it comes to really high-dimensional, structured clinical data such as images or maybe EEG traces, and integrating that with really messy human data like clinician notes or the testimonies of patients. But it heartens us to see that there are some AI companies that are really keen to take on that challenge. iCarbonX is an AI company based in China who's created a digital alliance partnership of 7 companies in order to turbocharge their ability to develop AI that performs multi-omics analysis. And when we say multi-omics, it's the process of having integrated analysis of different types of omes, so genomes, transcriptomes, microbiomes. What is interesting about this partnership is that they're not only focusing on the biological data, but the core kind of driving principle is how they might improve patient outcomes. And by partnering with the patient network, Patients Like Me, they're keeping that core focus at the heart of their enterprise. I've talked about data collaboratives. A pilot that is really interesting in the US that takes this as their starting point is the Project Doc initiative in Texas. They've brought together partners from community organizations, also retailers such as Walmart, and technology providers like IBM and AT&T in order to better track how diabetes and obesity is affecting a local community. They've introduced monitoring stations in Walmart stores and also developed a new app so that patients can self-manage. These different sources of data are then integrated with the types of data points that the doctors are collecting. And they're developing a new model with IBM Watson in order to better understand health behaviors in the community and identify potential intervention points. PwC in this partnership is acting as a data steward to ensure that all of the partners are benefiting from that data exchange. Finally, I want to just mention something I haven't spoken much about. It's how we make decisions in healthcare. It's often very high stakes, and there's vast evidence that when we make decisions in groups, there can be better outcomes for patients. We think that the most exciting AI technology is helping to enhance that ability. We're funding a company called Unanimous AI who works with a new technology platform called Swarm AI, modeled on the kind of interaction that you see in nature between swarms and flocks, in order to moderate human decision-making. In experiments they've tried, it's been proven to improve the diagnostic ability of groups of radiologists in comparison with individual radiologists and automated methods. Hopefully, all of that has given you an overview of some of the opportunities of applying collective intelligence and artificial intelligence as part of that to challenges in healthcare. And I want to finish to draw your attention to an opportunity that we hope you'll take advantage of and apply for one of our collective intelligence small grants. So this year, we've partnered with 3 other organizations, one of which is the Wellcome Trust. So we have up to $500,000 fund to give out with project grants of up to £30,000. And at least 5 of those are ring-fenced for healthcare applications and how we might draw on collective intelligence and artificial intelligence to better design systems that achieve the health outcomes we want. There'll be leaflets, I think, out in the corridor, but if you want to find out more, please come and talk to me afterwards as well. Thank you.